You know, like so many New Mexicans, I come from a family that dealt with substance abuse in a very real way. It was something that weighed very heavily on my family. That, you know, created challenges like financial insecurity, you know, brought on stress, pain, worry to my family, really hit us at our very core. And I know that that's an experience that isn't unique in this community, is something that is at the forefront of so many families' minds when they think about what the next day looks at. And I'm curious to know what innovative approaches and strategies should we be looking at the federal at supporting with federal resources that can really make a difference on the substance abuse disorder challenges that we're facing within our state?
Okay, so thank you for this opportunity, Victor, because I want to talk about two things. First, when we talk about substance use, maybe it's just me, but I think a lot of people think about IV drug users. Mm-hmm. So I want to talk about that, and I also want to talk about alcohol. But first, let me talk about IV drug users. And so under the Governor Lujan Grisham, prior to COVID, of course, we were looking at this, and a delegation went to Vancouver Canada, to look at safe injection sites. And I think this is shocking to people. When you first hear about it, it was something I had to think about, but I did go. And the concept of safe injection sites is that people who use IV drugs have a place to go that is supervised. It doesn't endorse it, it doesn't encourage it, but it's a safe site. And Vancouver, Canada is famous for this. And so we were privileged to go there and learn. And it isn't, so there's many criticisms, and it might shock some people, but I salute the governor for being so proactive and exploring it. And we also went with the city of Albuquerque to give them credit. They went as well. The reason I think this is something that the state should not abandon, even though we have a lot of problems, is that it prevents drug use on the streets. It prevents needles in parks. It encourages people to be in a safe place, in a controlled space where overdoses are addressed immediately. And if treatment is an option, is something someone wants, it's immediately available, but so is other healthcare. So there's a lot of good reasons not to abandon this idea, as shocking as some people may find it. It isn't to encourage IV drug use. It's because this addresses a lot of the issues with of drug use that and makes an avenue for treatment if people seek it.